So, Li-Fraumeni is another rare hereditary tumor predisposition syndrome. And in particular, these patients develop malignant tumors and at a relatively young age. And in fact, individuals with Li-Fraumeni syndrome have about a 25 times increased chance of developing a malignant tumor by the age of 50. And this is compared to the average population. So, Li-Fraumeni is caused by mutations in the p53 tumor suppressor gene, or TP53, which is responsible for initiating DNA repair mechanisms, or apoptosis, upon the detection of DNA damage. And individuals with Li-Fraumeni syndrome are born with a mutation in one of their p53 alleles, and then a second hit results in the loss of functional p53 protein and then tumor progression. Now, the phenotype of Li-Fraumeni is considered to be autosomal dominant, and it has reduced penetrance at what is thought to be about 90%. Some cases, though, are the result of a dominant negative mutation in which the protein from the mutated allele inactivates the protein from the normal allele. And there is also a variant of Li-Fraumeni that doesn't have a mutation in p53, but instead it has a mutation in the CHK2 gene, which is also a tumor suppressor that detects DNA damage. The most common malignancies that occur in Li-Fraumeni are soft tissue sarcomas, and sarcoma just being a term for a malignant tumor that arises from cells of mesenchymal origin. So cells that are from, say, bone, cartilage, fat, muscle, or vascular tissue. And so kind of going along with that, Li-Fraumeni also leads to bone sarcomas, as well as breast cancer, acute leukemias, adrenal cortical carcinomas, or cancers of the adrenal gland, and also brain tumors, and in particular glioblastomas. And because of this constellation of findings, Li-Fraumeni syndrome is also known as the sarcoma, breast cancer, leukemia, and adrenal gland syndrome, or SBLA syndrome. And that's because these tumors make up about 80% of the cancers that occur in association with Li-Fraumeni. And so hopefully just remembering this little shortcut, SBLA syndrome, in association with Li-Fraumeni will help you in the future. Now let's make a little bit more room here and talk about the diagnosis of Li-Fraumeni. So diagnosis is usually by the use of the following three criteria. The first being diagnosis with a sarcoma at any young age, usually the cutoff is the age of 45. The second of the three criteria is having a first-degree relative that's diagnosed with any type of cancer below the age of 45. And then the third is having another first or second degree relative with any cancer below the age of 45 or a sarcoma at any age. And then once a patient has met all three criteria, you can perform genetic testing that can possibly identify genetic mutation.